Salibonani. Welcome to the Girls Table podcast. I'm your host, Nyathi. On today's podcast, I want us to talk about limited access to equality healthcare and social services. As of what you can find with the corruption that leader to misappropriation of funds which are intended for healthcare, social services programs. Njalo futhi kuba le directly impact kuma youth population, and you can even have limited access to that quality healthcare and social protection. Njalo lokuthi khona nje just amanye essential services ngoba lokhu kuyakwazi ukuba severe consequences kuma wellbeing overdevelopment nje. Sizaba lo mamanyana onguye ongasichasisela kahle ukuthi yena yini angahlangane lakho just because of ukuthi kuba le limited access to equality healthcare social services. Ngicela ukuthi ushare your experience regarding ukuthi corruption kuma healthcare social services how affect kanjani ukuthi uthole access to equality service lokuthi ube nje le overall well-being yakho. What specific challenges have you faced when trying to access equality healthcare and social services lokuthi how have they impacted you?
Sawubonani lapha likhuluma lo Mcengudube. Bengithanda nami ukuthi ngiyethula olwami udaba engidibane kwindawo ezibhedlela, if I can say maybe social services. Kwenzakala ukuthi ngike ngahamba esibhedlela ngigulelwa umntwana. So ekufikeni esibhedlela laphana bekungela kutshengisa ukuthi kulabantu abazimisele ukusebenza or ukuthi bephakamise inyawo or ukuthi bekunake for that matter ukuthi uhamba ngani. Owabanga ukuthi sihlale isikhathi eside singatholanga usizo. Ekuhlaleni laphana umntwana wayelokhe esiya ephela amandla. Like the more we waited, the more danger we were facing. Yet besisesibhedlela. So kwenzeka ukuthi size sicine la sesizama ukukhuluma ukuthi lapha sesilinde isikhathi eside usizo asilutholi. One umuntu wasiphendulayo wasitshela ukuthi nakasizwa ngoba yena asondebele, yethi sikuyindawo zamandebele, uyabona. Kwenzeka njalo lapho uyabe usuphenika lawo usulolaka usubona isituation yabukiyo ngapha umuntu ekuphendule njalo. Kodwa ngebhathi azanga kusahamba kahle ngoba umntwana wagcina ephela. So asazi ukuthi besingancediseka kanjani. Yini ebengenziwa ukuthi sithole usizo, ukuthi sithole ukuncediseka masinya masisesibhedlela. Njalo ayisikho ukuthi umuntu uyabe hlezi elinde wena uwedwa. Kodwa la uyabona ukuthi akula into yabeyenza. Babe bebhoda besiyale. Mawuthe wasizwa sokunjalo sokuthiwa akula medication esibhedlela. So kumele udinge imali yokuyadinga medication ekhemist. So umsebenzi wesibhedlela kahle asisawuboni besicela sibili uncedo.
Socabanga ukuthi yini esingayenza ukuthi sikwanise ukuthi simelane nokuthi nxa wena uthe wahlukumezeka lami kumbe into engahlukumezeka ubone ngani yini engasinceda ingasisiza ukuthi sikwanise ukuthi siyekhuluma lokho kusesifubeni zethu, siyekhuluma lokho kusihluphayo ukuthi asihlukumezekile esigabeni esithile, sihlukumezekile endaweni ethile. And njalo uma sikhuluma ngakhona ukuthi mebhenxa sibekwazi ukuthi uza accountable, sikwanise ukuthi abantu bangikhona basincede lokuthi basisize ukuthi siyenze njani, what's the way forward, singabi lokwesaba. So yiwaphi ama-ways ubone ngathi angakwanisa ukuthi si-demand that better service esiyifunayo ezasinceda.
As much as abantu beqhatshwa ukuthi besebenze, I think akusela that thing yokuthi umuntu uze emsebenzini, umuntu usekhangele kuphela ukuthi inyanga iphele ngihole. Ukuzimisela akusekho. Njalo makungatshintshwa ikakhulu endabeni zolimo ukuthi abantu abakhuluma ulimi oluzwiseka kangcono batholakala ezindaweni lapho kulo majority khona. angazi mhlawumbe kuyezwakala ngendlela engichaza ngayo. Njalo besicela impela abantwana abangani bancane mhlawumbe abayibo abale kusasa eliqhakazekileyo bebe yibo abatholakala endaweni ezinje, ngoba mhlawumbe lokukhula lokukhathala abantu abaselalo uthando lomsebenzi.
Siyabonga kakhulu Nomcebo ngokushare isitori sakho lathi, ngokushare konke ahlangana lakho lokuthi waphatheka ngakho kanjani. So now we're going to welcome our expert onguyoza sichazela laye kabanzi u-Ashley Nhliziyo, u-Programs Manager for Linear Youth Center for Youth. Siyakuyamukela ku-podcast yethu. Ungasishayela nje kabanzi ukuthi as an aspect ukuthi how would you define equality, healthcare and social services, and what criteria should be considered in this definition?
As a young person, I believe that quality healthcare and social services are essential for ensuring the well-being of young people. Therefore, I would define quality healthcare as healthcare that is accessible to young people. It's also available. It's also affordable. And also looking into the youth perspective, I would also define quality healthcare as youth-friendly service provision, also maybe patient-centered care, and also inclusive healthcare services, because we cannot really disengage quality healthcare without talking about vulnerable groups. And when I'm talking about vulnerable groups, maybe I would love to zero down on persons with disabilities. So we're looking at a healthcare center which has service provision for persons with disabilities. So persons with disabilities can now access these services because, well, it's easy to get there and all of that. And now maybe when we're looking at the social services, well, we'll be talking about economic empowerment of young people. And maybe when we are zeroing down on what is really happening right now, we have the El Nino. Therefore, young people need to have income generating projects which can give them, economic empowerment, and they can make, an income and a living from that money which they get. And maybe in the words of Linda Gail Becker, she says that it is very important that we learn how to conceal around choice. And for me, this would mean that young people are diverse. Therefore, when we're talking about quality healthcare, now we're talking about availability of different options for young people,
Okay, so in what ways do corruption and misappropriation of funds specifically affect the quality and accessibility of healthcare and social services for the youth?
I'd also like to highlight that corruption and the misappropriation of funds significantly impacts quality and accessible healthcare and also social services which are available for young people. Maybe just to zero down on the health sector corruption survey, I think it was done by TI Zimbabwe. You'd note that there is a lot of corruption which is going on around the health sector in Zimbabwe, and also our recent Auditor General's report shows a lot of misappropriation of funds. And when you look at this, you're like, where are we really going as a nation? And also we would also look at the Zimbabwe Vulnerability Assessment Report, which shows heightened levels of corruption in our country, especially looking at social services and issues around healthcare. So as a young person, I'm really concerned about the increased vulnerability of young people and exploitation which is going on and the abuse of young people, because there is no accessible healthcare service which is now available. Therefore, young people are now vulnerable to abuse, to sextortion, and so forth. And when I'm talking about misappropriation of funds, maybe the effect would also zero down to heightened mortality rates, also shortage of medical supplies and clinics. Now we're talking about shortage of essential services like the paracetamol, which is supposed to be available at maybe our local clinics, but you'll not find it out there. You probably find it in our local markets, being traded for like ridiculous amounts, which actually shows that there is a lot of corruption which is going on. And because of corruption and misappropriation of funds, I think our country is now facing brain drain, because you now be thinking that, okay, fine, I'm better off contributing to a more viable economy than this one, because I also believe that health service providers are the calling. And now with this heightened corruption and misappropriation of funds, people would rather go and find greener pastures, because there is nothing green about the ongoing corruption in our country. And yeah, I think this really affects young people, because now we're looking at young people being vulnerable to a lot of things, and being the ones who are exposed to heightened levels of corruption. So I think corruption and misappropriation of funds is an issue which really needs to be addressed.
So, what roles do transparency and accountability play in combating corruption in healthcare and social services? How can communities effectively hold leaders accountable? Because we find it very hard to hold leaders accountable when we come across issues like transparency, accountability, and even we find there is corruption in the one.
Transparency and accountability are very essential in combating corruption, and young people should hold their leaders accountable, especially when it comes to misappropriation of funds. And maybe young people can or have used different ways to hold leaders accountable, and some of these include social audits, citizen scorecards, and the community evaluations as well. And young people are also supposed to be aware of different platforms which are actually available for them to report corruption, maybe corruption within the healthcare sector, or maybe the educational sector and all of that, because they are largely affected by this. And when we're talking about this, we're now looking at ZAC, we're now looking at Transparency International, we're now looking at the Auditor General's office. So young people really need to be aware of these, because this is where they can actually report ongoing corruption. Because if we don't report, this means that we're really comfortable with the ongoing corruption which is going on within our communities. So reporting is one of the ways which we can hold our leaders accountable.
Thank you so much for sharing with us. As young women, we're supposed to hold leaders accountable no matter the situation. As long as I feel good, we have to speak out and say it out loud there, and to help another young women as well tomorrow, they have the right to speak out and they have the right to hold leaders accountable, so that they change the situation. Because if we do not do that, the corruption will continue. Over and over again. We'll keep on complaining and crying about the same issues over and over again. So it needs us to stop recycling corruption by speaking out and holding the leaders accountable. Thank you so much for listening. Don't forget to like, share, and subscribe on the Girls Table channel. Thank you.
This project was made possible through a partnership between USAID Zimbabwe and ZimCode. The podcast is made possible by the generous support of the American people through United States Agency for International Development, Zimbabwe. The contents are the responsibility of the Girls Table and do not necessarily reflect the views of USAID or the United States government.